So just to start off, could you give us a short description of your profession and your role and how you've been involved with the pandemic?
Sure. First of all, I'm Joshua Kest. I'm a third year surgery resident. I'm also an alumni of Allied Health class of 2010. So it's been about 10 years. So towards the end of March, as the pandemic had started to get worse in this tri-state area, all residents were kind of recruited to be of help throughout the hospital. A lot of the things that residents normally did had to be adjusted because we had all these very, very sick patients coming in from with this respiratory disease that we did not fully have a full grasp on. As a kind of more senior surgery resident, we have skill sets that make us very useful, very helpful in ICU or intensive care units, such as having a good grasp of management of volume status, treating inflammatory diseases, placing lines, placing chest tubes, things like that. So normally COVID management initially had fallen more on like the medical side, but as we were getting swamped with more and more cases, having more and more sick people, they recruited the surgery side, the surgeons who had critical care experience and the residents, and so we were placed in the ICUs. I was basically in charge of one of the people in charge of working in COVID ICU for about 8 weeks, and it's been close to 4 weeks since I stopped working in a COVID ICU because things in the New York City area in general have gotten better.
Do you mind telling us how long were your shifts and how long you've been working in the COVID floor?
So my shifts were either 12 or 24 hours. I would go usually 2 times a week. I would do a 24-hour shift and then get the next 24 hours off. And then the rest of the week, I would do 12-hour shifts. And then that would be for 1 week. So I'd do like 80 hours 1 week that way. And then the following week, I would do the night shifts where you just do night 12-hour shifts. And that would be like closer to 72 hours a week. So it was alternating. And I was on COVID ICU floors for a total of 8 weeks. And just to give some like more background information, there were different kind of floors for COVID patients. There was the floor for the COVID patients that were the sickest of the sickest that required intubation and mechanical ventilation. That's where I was. But then there were also floors for that were not ICUs for patients that were found to have COVID but had like some respiratory distress that only needed some oxygen or needed some like a nasal cannula, some sort of supplemental oxygen. And then there was like a floor where there are patients that required a little bit more than nasal cannula and high flow nasal cannula and actually needed to be on something called like either BiPAP or CPAP. And so there were different like kind of like levels of COVID patient care. And there were times where patients would go from what the floors where they would look kind of like stable, kind of okay, and then would require intubation, then would have to get transferred down to an ICU level of care. And fortunately, there were also instances where like the COVID ICU patients kind of got better, and then they could leave the ICU. They would get extubated, get removed from the machine that was doing like all the breaths for them and everything, and would go down to like a more stable floor.
So you spoke a little bit about PPE earlier and like what the process was like about like donning your PPE and everything. How dire was the need for PPE where you were, and was there a shortage of PPE? Were people using handmade masks?
Initially, there was definitely a shortage of PPE. What some of my attendings did and some of what other people did were they would get like 5 N95s, N95 masks. Actually, I have one here, like 5 of these, and there's different types. Not this isn't the only one. They'd get 5 of them and rotate them over a span of 5 days and do things like either put them in the oven for at like really high heat for specified amount of time, or they would let them air dry over that 5 days. So like you'll label them 1, 2, 3, 4, 5, and you'll wear one on one day and you won't wear it for another 5 days. You'll wear number 2 the next day, then not wear it for another 5 days, and then keep that in rotation. That's what we were doing earlier until we had like some family members that were nice enough and they bought PPE from like places like Home Depot, etc., and they would send it to them, and then they would distribute it to us. And then there came a point in time when the government finally, chipped in and was able to secure us all these PPEs that we now have. And now getting PPE is not a problem, but there definitely was a time and point where it was difficult, and we just had to manage with whatever we had. Fortunately, at my hospital, well, on the floor that I was at, I never had to worry about PPE, but I do know that in our emergency department, there were times people would just don like trash bags and stuff because they had nothing else. But fortunately for us, after probably a period of like 1 to 2 weeks, we were able to get all the PPE that we needed.
It's like a different perspective from what we've been hearing, and it's great to hear from like someone who's been there. We heard about all the shortages and stuff, but I wasn't really sure how people were coping with that. So that was really interesting to hear. So like as the country is reopening, and you said there was like a decrease in the amount of cases. What has been like kind of the progress that you've seen?
I think New York, New Jersey, the tri-state area in general, did a very good job in terms of getting on top of everything. I think initially, like everyone, once they started to see how dire the situation was, and New York, New Jersey, these are population dense areas, so it's much easier for the virus to spread in places like these because everyone's just in very, very close in close contact, and everyone takes like public transportation, and people, like a bunch of people live together. So it's just very easy for the virus to spread.
I think for us, we've been seeing a lot like with the protests and everything coming on the news. Like there's been hikes in numbers, but I wasn't sure like from state to state how it's differing right now. So that was
So they
really
actually looked at New York, like following all the protests and everything, and they've actually found that like the BLM protests and everything haven't increased the numbers in at least in New York. I think that's partly because all New York, I think most New Yorkers are taking this seriously, and even like in the midst of their protesting and everything, everyone was wearing masks and just very conscious of the fact that even though there's another thing that we're fighting for in terms of like justice and everything, that they were still cognizant of the fact that coronavirus is still here and it's still around.
So I was also curious about patients who aren't COVID patients, how maybe you could talk a little bit if you knew of how they were being cared for during this whole thing, especially at the peak of the pandemic.
At the peak of the pandemic, there were many. I think the general thing that was being told to everybody was, stay at home. Stay at home. If it's not that serious and if it can wait, stay at home, because we didn't want cross contamination, and for regular people who probably didn't have COVID to come to the hospital and then just put themselves at risk of getting COVID. Because there was a time, like in the beginning, like our emergency department would have over hundreds of people, would have over 100 people, and many of them for respiratory problems, likely COVID. So there was no way around not potentially being cross-contaminated. If there was a low likelihood of not being cross-contaminated if there's so many people overwhelming an emergency department, and someone who, if someone came in who didn't have something like life-threatening or like serious, came in just for like a small checkup of something, so they really advised them to go home. And what was nice is that this helped increase like the use of telemedicine. People started to really work on, calling their doctors, speaking to their doctors on the phone, having video visits, and visiting their doctors through the use of software similar to this one that we're using, similar to like a Zoom, and like similar to like FaceTime and stuff like that. And if people really did have to come in for evaluation, then they would come in after getting like expert advice over like means like such as this one, and then would come into the hospital to get checked, because just because there's a pandemic going on does not mean that you should not get yourself checked if there are like serious things that you have that are going on. It's also affected people in the sense that some people were so afraid of coming to the hospital that some people unfortunately had exacerbations of medical issues, medical problems that they had and did not seek care in time. And there were some people who were so scared that we've heard stories like basically died at home from issues. So we had like so the people who didn't come in because they were scared of COVID, they had various outcomes. They either had like negative outcomes, or they were able to like get a hold of like a provider, talk to them, and then the provider was able to like determine whether or not they need to come in, or if they could just take care of the issue over the phone and defer them coming in until after COVID gets much better.
So you talked just now, you said a little bit about how like telemedicine can't completely replace, like you still have to be in person for some things, and that's important. So I recently talked a little bit about this with my grandfather, who's a psychiatrist, who was talking about how important it is to be in person with people and how important that is psychologically. So I was curious for you and your mental health, and the fact that you worked with COVID patients. How did that take a toll on you personally, if you're comfortable answering that with your psychological health?
So initially it was very difficult initially. Fortunately, personally for me, my faith has been something that's helped me, throughout my journey to medicine and throughout everything I've done in my life. So I had that to always like fall back on. We also had many team debriefings, because unfortunately, like when this thing first started, especially when we had the sickest of the sick patients, there were many patients who we tried everything for, but no matter what we did, they ended up passing away. And it was very tough, because you'd see multiple people that you're taking care of that would just pass away, like one after the other, and you don't even have like the time to mourn them really, because in maybe like a couple hours after they pass away, their body gets taken to the morgue. There's more sick patients just coming in, getting ready to take over the room of that patient that just passed away. So you don't even get a break to really process everything that's happened. And I think our leadership did a really good job of having many debriefings. They opened up a meditation room in our hospital as well, that providers can just go to like kind of like just like catch a break, whether it's before or after their shifts, and just kind of like think of everything. You had people that you're going through the process with, your other residents, fellows, attendings, nurses, everything that you would also talk about everything with. And then I also had my family who knew what I was going through, what I was doing, and they were also just like very supportive and everything like that. It was really tough initially, especially because everyone was here just saying you're a hero, and like applauding you and like being thankful for everything you do. And even the families were, but sometimes it was tough. I think the most tough experience for me during it was seeing someone my age who passed away from it. Not too many times do you see people like 28 pass away from COVID. It's mostly like it's mostly people that are much older. But if someone's like sick enough, they'd pass away too. And I think that was also it was just like a very tough experience. But I think once again, like my faith, talking to other people, talking to my family, having many debriefings and stuff like that really helped. And I think the whole experience, when I look back at it like as a whole, helped me just like appreciate life more, and not to just be caught up in the moment of studying and trying to be the best healthcare provider I could be, but also encourage me to like just be the best person I can be as well, just generally. It was a very humbling experience, and it was an experience I was appreciative of too, because at the end of the day, you were able to save a couple people, and those people that you saved also made everything worth it.
Thank you so much for sharing that with us. It's truly inspiring to see healthcare workers, especially allied health alumni, like we're all one community, and like hearing your story about how you were able to help people in the hospital, and even your struggles. It's really inspiring. So kind of shifting to a kind of a different note, but at students at Allied, they're very eager to get involved in helping healthcare workers on the front lines. And we would like to hear from you. What can we do that could help you healthcare workers right now?
I think probably the most important thing that you guys can do is to stay vigilant, and to definitely make sure not to slack off now that things are starting to open. I read an article today that talked about I read an article today that talked about like as these cases are increasing in other places, they're saying that a majority of the spread might be due to people under the age of 29, which you guys would all fall under, because there are people who are tired of being like quarantined, not being able to do what they want to do, and so they start having parties and have no masks at these parties, don't social distance and everything like that. And they actually were able to like trace the outbreaks to people and parties that they attended. So I think one of the most important things you guys can do is to stay educated yourselves, be vigilant, wear masks when you guys are going outside, and all other sorts of PPE. Keep on washing your hands frequently, have hand sanitizer, because the coronavirus itself can stay on specific surfaces up to like 2 to 3 days. So you might think like you're okay, but you could easily just like touch like a doorknob, accidentally touch your face or something, and then either start to manifest symptoms and then become someone that could a vector that can spread the disease. I think the other thing you guys can do is look and do research and see if there's any hospitals that still require things like PPE, and you guys can donate some PPE if you have any, like they were doing in the beginning. And then if there's any organizations that require like donations of like any kind, monetary or like anything, it'd be something to like look into. I think the definitely like I think our immediate surroundings are in generally like better shape, but you never know if there could be like a second wave coming, or and we definitely know that other states are starting to have like a really big problem. Like I know like Houston, I think, is running out of ICU beds. So if you could also just like look into maybe seeing if there's a way to help those places through like donations and stuff like outside of the New Jersey, New York area. I think those would all be great ways to help out.
That was definitely very helpful for all the allied students and even us seniors going off to college. So looking forward into the future, so we understand that you're planning on going into plastic surgery. Is that correct? So do you mind going into a little bit about your path to becoming a doctor?
I knew since I was in middle school that I wanted to be a doctor. And I had seen like a family friend come from a different visit from a different country, and they had a child with Down syndrome, and that required a procedure because they had basically like a hole in their heart, and which is something that's common for that sort of population. So I saw a cardiologist, a peds cardiologist, do a procedure to basically help the kid, and I was like so amazed because basically they did something that changed the outlook of that child. That child's life expectancy probably increased by a lot because of the procedure that they did. And ever since then, I saw like the way it affected my family, who was helping my family friend, and I saw the way it like affected my family friend, the family. And I also had other experiences with doctors, and I knew that I want to do something that could have lasting changes on people. And so that's why I decided to apply and then go to allied health. Then in college, I did a lot of volunteering. I did leadership. I was president of my school. I did neuroscience research and some shadowing, and applied in my second year of college to a 7-year BAMD program where you matriculate. Basically, you do your third year of college, and then your fourth year of college is your first year of med school. So I got into the 7-year program at Robert Wood Johnson, and even before I did that, I went to Nigeria and with a medical mission team, and did a bunch of plastic surgery on with mentors, and saw how the things we did really affected the people there. And ever since then, I wanted to be a plastic surgeon. Many people think of plastic surgeons as the people that just do a bunch of cosmetic things, but that's a small percentage of what they do. I was always interested in the reconstructive side, and was really interested in reconstruction because of congenital things or cancer sections or traumas that people sustain, and then to be able to kind of give them back function by operating on them was something that was very satisfying to me.
Wow, it's so interesting that you're going into that field, because I really never thought of like plastic surgery in that kind of sense. So that was really interesting to hear about. Do you have any advice for like current allied students looking to go into medicine, or kind of like graduating seniors going into pre-med?
Mm-hmm. So I think the most important piece of advice I can probably give to you guys is that it's not necessarily going to be easy. I remember being pre-med, and I remember starting. There were like thousands of people that started off and wanted to do it, and then maybe like they got like one bad grade or like one bad thing happened, and that was it for them, and they gave up. There are many classes I think colleges have purposefully that are meant to kind of, not officially, but kind of weed out people, and people then believe that just because they didn't necessarily do great in this class, that they can't become a doctor or whatever. I think if it's something that you really want to do, you should stand by your convictions and go do it. I also think that if it's something that you guys want to do, then you have to make sure it's something that you want to do and not something someone else wants you to do, and make sure you take opportunities to shadow and everything. Because the truth is, there are still, some people who like go into the field, who are pre-med and go into it, and you get to meet them and everything. You see that they're not really passionate about it. So you have to make sure that it's something that you are actually passionate about, and the way you like kind of figure that out is by volunteering, being involved with orgs that give you like experiences like that. And when you do those things, you'll be able to better see that, oh, I am passionate about this. And when you find out that you're passionate about it, when you actually realize you're passionate about it, you will drive yourself to do those things. So I think the greatest piece of advice I can give to you guys is don't give up. Find mentors as well. Find other people that are like-minded, where you guys can keep each other accountable, because it's a marathon. It's not a sprint.
Thank you so much for talking with us today.